Good morning. Thank you for inviting me. My name is Anna Romano. I live in Greenville, South Carolina, and I have a lot of questions regarding the changes in this new bill. I am legally disabled. I receive benefits from Social Security, Medicare, and SNAP. I also have support from the Extra Help program, which is funded through Medicaid. I appreciate the help, and I do not take it lightly. I have been legally disabled since I was 19 years old. I am now 43. My disability stems from mental illness. Inpatient visits at psychiatric hospitals became a revolving door, and I lived 6 years in a group home for adults with mental illness. I spent many years learning how to navigate my mental health. I see a therapist to help me with my thoughts and emotions so I can function and live independently in my own apartment. I take medications daily. They help slow my brain down, and they help keep the depression from becoming too overwhelming. But they only help. I must also utilize the tools and skills I learned from my therapist. However, all this makes holding down a job very difficult. Now, let me be clear. It's not a matter of me not wanting to work. I would work if I could, and I have worked part-time when I was able. In fact, I worked enough and paid into the system to qualify for Social Security disability insurance and Medicare. The trouble I have is staying employed without ending up in the hospital. And hospitals are expensive. With Medicare, there is a lifetime limit of 190 days for inpatient psychiatric hospital stays. I ran out of my allotted time years ago. With much deliberation and listening to my doctors, I decided my job, is to stay healthy, out of hospitals, and to participate in my community as best as I can. I also have chronic kidney disease. My kidneys cannot get better, but I can keep them from getting worse. It requires specific diet set by my doctors and follow-up appointments every 6 months. SNAP allows me to afford the healthy foods I need to keep my kidneys functioning without needing dialysis or worse, a transplant. I do not qualify for Medicaid insurance. However, Medicaid does fund the Extra Help program. This program pays the yearly premium for my Medicare. It also provides me with Part D coverage, paying the annual premium and deductibles for my medications. And it keeps my medication copays low. I have a lot of questions about what is changing, but so far I have not found anyone with answers. I regularly check government websites. I try to call Medicare, Social Security, and DSS, but there are few people available to answer the phones. Living on a fixed income is already challenging enough. I plan diligently each month, and I do not have much left over. Now I feel like I'm in limbo. I need to know if I'm at risk of losing the Extra Help program funded by Medicaid. Last week, while going through the recertification process for SNAP, I learned my form of disability does exempt me from work requirements. I do not yet know if the amount I receive will be reduced, and that will hurt if it is. I do not know if I will be able to afford to buy my food if it is reduced. I have to wait for it to come in the mail because that information is not available online. And again, like I said, it's hard to get people on the phone. With rising food costs, I will need to know if I can continue to afford the healthy foods my doctors advise. And I need to know that I can call a government office and speak to a live human being who can answer my questions. Thank you.